Hi, and welcome to my blog today. Today we're going to be talking about MS itching. I don't know if you or someone you know has MS, but if they ever complain about this itching that just won't stop, they are completely right, and listen to them because it sucks. I had it for so many years, and the medical community wouldn't even justify it with an answer. I mean, they just said MS was not caused by itching, and yet I just saw today on Everyday Health a normal Google search MS itching, and there it was, MS itch. So the good news is that now all the medical community is now writing about it, and in fact, it has been classified as a complication, whether it be secondary or what have you, that itching can be a part of a struggle with someone with multiple sclerosis. Now, I'm sure that if you're watching this, you know that there are several different kinds of multiple sclerosis, and mine is relapsing remitting. And that means that I have times where I feel pretty good and times where I just don't feel good at all, and I can't think or read or write, or I'm just a mess. So there's also progressive. Progressive is bad. Progressive can kill someone within 6 months. It's very similar to like an ALS type of thing. There's also different areas in your neurological system that can be affected by multiple lesions caused by MS. That can be of a lethal episode, which would be like if something in your heart, one of the nerves, that controls your heart, somewhere in your brain, your heart can just stop and you die. And that would be a fatality from MS. So it really can affect every part of you. I mean, it can affect just every part of you, every system that has a nerve, which means everything. So what do you do if you have MS itching? Well, topical lotions don't work. Save your money. Benadryl puts you to sleep, but you're still going to itch. And the Allegra or all those antihistamines over the counter, they just don't work. But the good news is that I did find something that does work. And you do need to get it from your doctor because it is a medication. I believe it's considered a mild sedative. And this particular medication is called hydroxyzine, something like that. And it, in the definition or the information that I found, was that it was sometimes given to people who are going to have some sort of anxiety over a dentist appointment or a procedure that gets them kind of antsy. So hydroxyzine works, and it will help you. So go to your doctor and let them know that you did hear that someone has taken hydroxyzine, and it's very effective with MS itching. So I just want to give that little piece of information. You could just tell your doctors to just get on YouTube and leave me a message if they want to ask me any questions. I'm here for them too. Next topic, because I really want to keep this moving. Pain in MS. Some people will say that their first MS symptom was, or the doctors, they look for these certain symptoms like you drop your arm and you can't lift it, or you start tripping over your feet, just these big, huge whammo signs like, oh, wow, that must be multiple sclerosis. Well, I never had those right away. In fact, I had every single one of them, including optic neuritis, but not for way farther down in the game. We're talking about 10, 15 years into MS did I start getting optic neuritis, and that's actually how they diagnosed me. But for the first 15 years, I was on my own because clinically, I just didn't qualify for what the medical community was prepared to diagnose as MS. So let's talk about pain. By the way, I am diagnosed. I've been diagnosed since 2009, so yay! And if I knew how to edit and make little cheer sound, I would, but I don't. So again, I digress. I would like to introduce you to an age-old, an additive that was once used by folks, to help them with cramps and I guess like muscle aches and stuff. And it's been around for centuries. And I'm going to reintroduce it to you because it helped me again with my pain. Now, before I start with this, well, I'm going to start with this, and then I'm going to tell you I also take something else. So I'm going to show you what it is, and then I'm going to go to what I take. Okay. I hope you can see this. I know, my light's kind of bad. Sorry. Okay, this is tonic water. And tonic water has something called quinine inside of it. Now, if you ask older folks, maybe in your church or your community, and ask them, do you know what quinine is? And they'll probably know what it is because it used to be prescribed. But it had some unfortunate complications to women who are pregnant. In fact, if it was taken in excess, it was causing abortion, spontaneous abortion, and the loss of pregnancy. So again, that's a serious side effect. But to me, this is my saving grace, because it has definitely helped me with my throbbing pain. And when I talk about, I'm not saying I went out and I built a house, I came home and I was hurting. I'm saying I woke up and I was hurting. That's the kind of pain that I have. So it's a constant nagging pain. So quinine, tonic water, Schweppes tastes better. Canada Dry is a little bit more on the dry side. Schweppes Diet doesn't really taste as good as Schweppes Regular, but the Schweppes Regular kind of tastes like grapefruit. It's actually kind of good. So quinine and tonic water. And also, if you know an older person who has what do they call those, jumpy legs or leg tremors, leg jumping, or people can't sleep, and restless leg syndrome. Thank goodness I don't remember. Okay. Quinine helps that too. My mother-in-law uses it every single day, and they've gone away. And she's had to take medication for these restless legs, and this helped her. Amazing results she's had with this too. After 2 years of me insisting that she try it, she finally did. Okay, enough with that. Now, other drug therapies to help with pain or muscle spasms that I found were effective were baclofen, which I take. Baclofen is very effective in helping me with my feet. You know, you have Charlie horses, you know, in your leg, and you get a cramp, and you're like, ah, or your toe goes, wee, and it won't move or something. Well, that happens with people with MS throughout their body. Again, in any system. So even in their face, like they'll get a droopy face, or their cheek will droop, or their eye will start doing that wacko stuff. And yeah, so that happens. And those are all muscle, contractions. And sometimes they just get stuck and they just hurt in places. Like my feet will like tense all up and they just won't let go. I mean, it's just like you're like stuck and it's painful. So baclofen is very effective. I think I take 10 milligrams of baclofen twice a day. Again, your neurologist, even your primary care physician might be able to prescribe that to you if you're diagnosed. So baclofen so far, and hydroxyzine. Okay, both of those are very effective so far. We've talked about hydroxyzine for itching. Yay, it's an antihistamine and a mild antidepressant because it calms people down. It's fine by me. I'm past all the titles and people putting these, ideas, over my situation. I'm done with that. I've moved on. My life is different. Wah. You go forward, If your life ends in one way, you just take another road. Just keep going. Don't stop. Don't pout. Don't feel sorry for yourself. All that's going to do is make you worse. Okay, I'm off my soapbox now. I'm sorry. My mother used to feel sorry for herself all the time when I was a little girl. I was 5 years old, and I would be consoling my mother as she sat in a chair in our living room with a cigarette in her mouth and iced tea in her hand and just blubbering. And I got to tell you, I don't have the stomach to endure that type of self mourning, if you would. So if I sound a little critical, I apologize, but I've come to understand that it's not necessary. Because, yeah, I get depressed. Yeah, I've been depressed. Believe me. A few videos down the road, you might hear why. And it's not just MS. It's just this stinking life we're in. Okay, so, what was this? Oh, let's talk about hives. Ooh, 10 minutes. I'm going to have to go quick. Hives are not just caused by eating a food that you're allergic to, or a smell, or any other thing that the doctor will tell you. Hives can simply be caused because your nervous system is shot. Now, how do I know that? Because I have them, and I've had them many, many times. And if I can figure out how to make a slideshow, I'll put it up here so you can see what I look like when I have hives. It's beautiful. In any event, wonder drug for hives, go away, bye-bye, paroxetine. It's called, the generic name is, or the name brand is Paxil. Fixed, all better. I've had great results with it. Some people don't. I have been blessed. These medications have helped me a great deal. So, 11 minutes. I've been told that that's not good. We should probably go. Well, I just wanted to make sure that I covered something worth something. I think I did. So we covered tonic water has quinine. That'll help you with your muscle spasms and cramps. Also, baclofen is very helpful for the treatment of muscle tightening and pain in your muscles from contractures that's caused by the spasms. Hydroxine is very effective for MS itching. And I did quinine. I guess that's it. I'll have to make another video for everything else I want to say, because I really want to keep this reasonably short because you've got stuff to do. Okay, I hope that you enjoyed this video. Give me a thumbs up. Leave me questions. I asked for questions last video. I'm not good at this. I'm going to keep on going on and on and on and rambling. You don't want to hear me ramble? Give me specific questions so I can read them back to you. I don't have to use your name. You're going to know who you are. Make up a name. Say I'm Daffy or I'm Inga. I don't care. Just give me your questions so I can answer them. I have been through 25 plus years of multiple sclerosis. I knew what was going on with my body before the doctors did. You're just going to have to give me your questions so we can just go from there. Because like I said, I can do the best I can here and bring up topics that Robin has given me in emails. But I think it would be better if you just gave me questions. So the next video I'm going to make is going to be about diagnosis and what you should and should not be disappointed in when you get your blood work back and you have nothing to show for it. Zilch. Nada. Don't be depressed. That's good news. Okay, well, I guess I'm going to stop. But I'll see you next time. Take care. God bless. Bye-bye.